Hello students, in this video I would be talking about the greater sciatic foramen and structure passing through the greater sciatic foramen. This greater sciatic foramen and its formation and structure passing through it is very important topic in especially Pakistani and Indian medical education system. So my focus would be on that. Here we are looking at the pelvis from the posterior aspect. Here we have sacrum to hip bones, and this is coccyx. And here we have greater sciatic notch, and then we have got lesser sciatic notch as well. So we are actually looking at two very important ligaments. This one here, the bigger one or broader one here, you are looking at the sacrotuberous ligament. Sacrotuberous ligament, because it is present between the sacrum and ischial tuberosity. Sacrum and ischial tuberosity. And here we have got another, small structure which is called spine, and this ligament here you are looking at, it is actually spanning between the sacrum and the spine. So it is actually sacrospinous ligament, and this is sacrotuberous ligament. So what actually these two ligaments are doing, they are converting these notches, greater and lesser sciatic notch, into lesser and greater sciatic foramen. So I would show you the same from the another perspective. Here you are looking at the structure from the medial aspect. Here is the iliac fossa of the ilium, and here we have got spinous process. This is greater sciatic notch, this is lesser sciatic notch. So this is sacrum, inside anterior surface of the sacrum. So these two ligaments you are looking at from different angles. So this is sacrospinous ligament, sacrospinous ligament, because it spans between the sacrum and the spine of the hip bone. So actually this ligament converts this greater sciatic foramen, notch, into greater sciatic foramen. Here you are looking at greater sciatic foramen. So now lesser sciatic notch, here it's been converted into lesser sciatic foramen by means of sacrotuberous ligament, because it spans between the sacrum and the ischial tuberosity. So that's why this ligament is sacrotuberous ligament, and this is sacrospinous because it spans between the sacrum and the spine of the hip bone. Now you are looking at the same structure from the posterior aspect. This is sacrum, this is ischial tuberosity, sacrospinous ligament. Here this is sacrum, this is spine, this is sacrotuberous ligament, and here this is sacrum and this is spine. So this one here you are looking at sacrospinous ligament. So sacrospinous ligament converts this greater sciatic notch into greater sciatic foramen, and this is piriformis muscle. This piriformis muscle is actually getting out of the pelvis through this greater sciatic foramen. So this is the piriformis muscle is the first muscle which comes out of the pelvis through this, because it arises from the anterior surface of the sacrum and it comes out of the pelvis through greater sciatic foramen. And this muscle is very, very important landmark. And this opening, which is greater sciatic foramen, or it is called the doorway of the gluteal region, because all the structures, arteries, nerve, vessels, they are coming from the pelvis after passing through this greater sciatic foramen into the gluteal region. So this muscle is broad enough, this piriformis muscle. In this muscle almost completely fills the greater sciatic foramen, leaving just a small space around it for the other structures to come out. And this is, here you see, this is Obturator Internus, and it is coming out of the lesser sciatic foramen through through the sciatic foramen and getting inserted into the trochanteric fossa along with superior gemellus and inferior gemellus. So here is the next diagram. This is very important diagram or illustration. It is the illustration from it's my favorite one. Why it is my favorite one? Because this illustration teaches me a lot of things. This piriformis muscle, as we have discussed about, it is coming out of the greater sciatic foramen from the pelvis. It is coming out through the greater sciatic foramen into the gluteal region. So my Indian and Pakistani viewers or Nepali viewers, in our setup, you people are very much familiar with the, what you call sadhu or what you call pir, because it is piriformis muscle. So I call this muscle a pir sab of the gluteal region. Why I call this muscle a pir sab of the gluteal region? Because there are many structures which are surrounding this pir sab. All the structures, arteries or nerves, enter the gluteal region. Either they enter through the superior border of the piriformis muscle, or they enter the gluteal region through its inferior border. So this muscle is very important landmark, and this muscle is pir sab of this region. Because when surgeons, they perform surgery, they this muscle is very important to them, because they have an idea actually there are structures passing coming out of the greater sciatic foramen through the superior border or inferior border of the this piriformis muscle. So here, most of the time, here you can see the superior gluteal nerve. This superior gluteal nerve is coming out of the superior border of the what you call piriformis muscle, and this nerve divides into two superior and inferior branches, and it is sandwiched between the two gluteus medius and gluteus minimus muscle. Gluteus medius and gluteus minimus. So actually you are looking at how this superior gluteal nerve is supplying the gluteus medius and minimus. Plus, here you see a small branch of superior gluteal nerve, it actually piercing the gluteus medius and supplying the tensor fasciae latae muscle. This is tensor fasciae latae. So superior gluteal nerve actually supplying gluteus medius, minimus and tensor fasciae latae. Whereas this is inferior gluteal nerve. Here you are looking at inferior. Why inferior gluteal nerve? Because it is entering into the gluteal region from the pelvis, coming out of the greater sciatic foramen and appearing in the gluteal region under the inferior border of the piriformis muscle. Okay, so piriformis muscle. So look at the inferior gluteal nerve, how its fibers, they are supplying the gluteus maximus muscle. So here the thing is that gluteus maximus muscle is supplied by the inferior gluteal nerve, whereas gluteus maximus, medius and minimus, they are supplied by the superior gluteal nerve. And there are superior gluteal artery, superior and inferior gluteal artery, or superior gluteal vessels and inferior gluteal vessels as well, which are accompanying these superior and inferior gluteal nerves, which are not shown in this diagram, but you have to remember, first of all, piriformis, then superior gluteal nerve, superior gluteal vessels, then inferior gluteal nerve, inferior gluteal vessels. They are coming out of the greater sciatic foramen. Okay, now here you are looking at, this is thick one, this is called sciatic nerve. It is also coming from the inferior, out of the pelvis through the inferior border of the piriformis muscle. And just parallel to this, here we have got posterior cutaneous nerve of the thigh. This is the cutaneous nerve which supplies the largest area of the skin in the body, posterior cutaneous nerve of the thigh. And then here we have got nerve to obturator internus. It is supplying the superior gemellus. Here you can see this muscle is superior gemellus. It is being supplied by the nerve to the obturator internus. Then it is supplying the obturator internus itself, after which it is having name. So this nerve to obturator internus actually supplies two muscles, superior gemellus and obturator internus. And here you see, because there is window is being cut, so you could see the deeper structure. This is nerve to quadratus femoris. This is quadratus femoris muscle. So this nerve is supplying the quadratus femoris muscle plus inferior gemellus. So superior gemellus and inferior gemellus, although they are twin muscles, because the word gemellus means twins, they are twin muscles, but their nerve supply is different. Superior gemellus is being supplied by the nerve to obturator internus, whereas inferior gemellus is being supplied by the nerve to quadratus femoris. And then here comes the pudendal nerve. Here you can see pudendal nerve is leaving the pelvis through greater sciatic foramen. Then it is winding itself around the spinous process. Here spinous process. Then it is re-entering. It is leaving the gluteal region without supplying any muscle here, and it enters the lesser sciatic foramen and it supplies the perineal structures. For example, here you get scrotal branch, and here you dorsal nerve of penis, perineal nerve. So the word pudendum, it comes from a Latin origin word which means to be embarrassed, to be ashamed of, because this nerve actually supplies the genitalia, which are embarrassing organs of the body. So that's why it has got name a pudendal nerve. And gluteal nerve, it actually supplies the muscle in the posterior compartment of the thigh, then the all muscles of the leg and foot. It actually has no motor supply in the gluteal region. It is actually just passing through it. It is quite a thick nerve, which is 2 centimeter in diameter or width. Okay, it is the largest nerve of the body. So posterior cutaneous nerve, here these are two branches which are called inferior cluneal nerves. Actually these two nerves are supplying the skin of the buttock region from the inferior aspect, and these two branches which are called the perineal branches of the posterior cutaneous nerve of the thigh. These are the perineal branches. So this posterior cutaneous nerve supplies cluneal, which is nerve which is cutaneous, and here the cutaneous nerves of the, so its supply is all cutaneous. So in the same diagram here you see the piriformis muscle. It is coming out of the pelvis through the greater sciatic foramen. In the same diagram I would like to explain the in the same video I would like to explain the piriformis syndrome. Here you see the piriformis muscle. The sciatic nerve is actually comprised of two parts, common peroneal part and tibial part. Common peroneal part and tibial part, they originate separately within the pelvis from the lumbar plexus. Then they are held together in a same connective tissue sheath, which there they become the sciatic nerve, and just above the superior border of the popliteal fossa, it again splits into two, which are common peroneal and common peroneal nerve and popliteal tibial nerve. But sometimes what happens actually, sometimes it is I think my video length has gone too much. I'm going to make another video for piriformis syndrome, so excuse me here. I'm sorry about the about the length of the video. So I would be definitely uploading another video regarding piriformis syndrome. So goodbye up till now, from now. Thank you very much.